Good morning, good afternoon, or good evening, wherever you are. I'm Bill Maddox at the University of New Hampshire from the Center for Social Innovation and Enterprise. And this is the second in our series, Social Sector Franchising webinars. Today it's Social Sector Franchising State of the Field 2018. And I'm really excited about this webinar. We have with us as guests two gentlemen who have really been significant movers and shakers in this field, both within the social sector franchising field and also with larger commercial franchising space. And so we're going to be hearing from them. Our first speaker today will be Michael Seid from MSA Worldwide. Michael is the founder and managing director of MSA Worldwide, as I said, provider of domestic and international franchise advisory services, domestically and internationally for companies on the appropriateness of franchising, licensing, and other methods of downstream distribution of products and services, the design and development and implementation of franchising and licensing systems, and the development of and management of change strategies for established franchisors and non-franchisors. And also joining us today will be Peter Holt. He's president and CEO of The Joint. That's NASDAQ JYNT, just in case you're looking it up. Peter Holt has been active in the franchise systems in both domestic and international markets for over 30 years. Most recently, he was appointed Chief Executive Officer of The Joint, the largest chiropractic clinics in the world, with over 350 clinics system-wide. The Joint is a publicly traded company, as I mentioned, NASDAQ JYNT, and it's based in Scottsdale, Arizona. Let me give you a few ground rules of what we're going to do today in this webinar. We are going to do most of this webinar on screen, so you'll be able to see our guests, and we will be able to have a pretty extensive opportunity in the end for you to ask questions. So there's a chat box you'll see in the Zoom platform, a box at the bottom where it says chat. So as we're going along, please type in your questions, and then when we get to the Q&A part of the webinar, we'll be happy to ask those questions. We are experiencing some challenges with the activity. We're hoping that those will be temporary, but please let us know, as we just got from Amy Jones, who told us that it's coming a little patchy. If you do keep us posted, we'll do our best to try to improve the quality of the recording. The other thing that I want to mention is this broadcast will be recorded. It will be up on our website probably within about a week. So if you are not able to attend the entire broadcast or you'd like to refer back to it, we will have the recording available for you. And finally, we'll probably go the full hour, but I will have a few announcements near the end of the. So really thank Peter and Michael for joining us today on the SSFI webinar. And I'm going to launch right in with a question for Michael Seid. Michael, you've been involved with this work for quite a while. What motivated you to use your extensive expertise in franchising to help grow social franchising?
It was a challenge. It was about 15 years ago, I was buttonholed at a conference by someone who I actually thought was a bit crazed, and he would not let me go for about 4 hours. And his final challenge was, do you think that the structure of franchising can outperform an NGO model? And of course I said yes. And a couple of weeks later, I found myself in Kenya, running around trying to figure out if I could win the bet. And that's been the process going on. It was simply that. I had really no interest in the social sector. I was purely commercial. I saw myself as extraordinarily conservative. Everyone should do what they do on their own. And this was purely by chance meeting somebody in a hallway. That's what drew me into it.
Great. More recently, you've been involved, or really over the years, you've been involved in consulting specifically with social franchises and the family welfare shops were one of. Can you talk a little bit about that experience?
You broke up a second, Bill. I heard you say about CFW shops. Are you
Right.
looking for something broader?
Yeah, I was wondering what specifically, how you work with them.
All right. I didn't hear you, but I'll see if I can answer what I thought was the question. CFW shops I got involved in a very deep way. And we've now grown the system into Kenya and Rwanda, about 170 locations, all individually owned by nurse practitioners, have about 6 million patients. From there, it just became a mission to help in the non-for-profit world. About 12 years ago, I started at the International Franchise Association with the support of the board of directors, a social sector task force. Peter is a member of that, and we have now about 100 members that do a lot of very good things. And out of that, it became a support mission. So there are clients which we work for on a commercial basis because they're large enough to be able to support us. And there are others which we use our own corporate resources to support either on a pro bono basis or at rates which are pretty close to pro bono rates. But, you know, the mission in Ghana is one of the more exciting ones. The work that we're now doing with the Ohio State University, and I'm always told I have to put the "the" in there with an emphasis, in Tanzania is incredibly exciting because of its dynamics of bringing potable water, you know, to people's homes, and having it filtered and having it clean and at a price they can afford. Also for use in agriculture and dealing with some hellacious technological issues, which thankfully very bright students at Ohio State are dealing with. So that's that whole mission in there.
So can you talk about the franchising aspect of the Clean Water Project they're doing with OSU in Tanzania?
Tanzania brings up some real challenges. We're coming in after about 20,000 wells were established by a very large, well-known NGO, and within several months, those wells were no longer functional or even there. They had left behind no parts, no support, no program for sustainability. And now what OSU is doing, with the help of some incredibly bright people. I was appointed to the Global Water Institute board. And what we're doing is going back in and we are developing a system that will check the wells, reestablish the boreholes, put on high-tech equipment, solar-powered, and then we're getting into things such as filtration. And filtration for us in the first world economy is easy. We can go to the store and buy it. There it's very dear and difficult. So using charred animal bones, which are plentiful and can be used and restored at a cheap price, takes the chemistry out of the water that we're looking for. A lot of the wells that were put in place have high fluoride content. Fluoride is not good except, you know, for our teeth in small batches, but it can kill people. It deforms children. So we're selecting sites where the water goes. We are dealing with pressure and non-pressure piping. We are dealing with the issues of seasonality and storage, because in the rainy season, water is plentiful and cheap, and in the dry season, it's not, and you have to deal with it. So we have set it up as a supported franchise system. The first 4 wells are now up and functioning. The wells will be owned by the franchisees. They will be paying the town a fee for the use of the ground, even though the town is getting the water. There's a provision set up for making certain, from a sustainability point of view, that people that can't even afford the small amount will get water. There's provisions for the agricultural use of it, so jobs are created. But it will be set up as a true franchise system with a master franchisee in markets that will deal with installation and product and parts depots and support, and that's how it functions.
Well, that's really exciting, Michael, and it's really kind of what we talk about as the last mile distribution in social franchising at its really last mile. If you can deliver water to rural Tanzanians this way, that's really fantastic.
We will get within 100 feet of their homes.
Right, that is amazing. More recently, you have been involved in supporting the launch of an exciting model for antenatal care in Ghana that Access is running called Women 360. Can you tell us about this franchise model and why franchising is an important component of the design?
One of the learnings that is unfortunate is that the largest killer of women worldwide is giving birth. I was approached by Farm Access out of the Netherlands, well-known support company. And what we did was they developed a model which will take care of a couple of things. You have a shortage of capital in the market. You also have a brain drain in the market. So the resources needed for women locally is absent. And you're dealing with a population that generally is supported by well-caring but untrained midwives and witch doctors and a whole bunch of other stuff. And what we've set up there is again, using a hub and spoke system, using a master franchise approach. Each of the hospitals is a master franchisee. In fact, the two hospitals in Accra have been formed into a joint venture. They will be the master franchisee for the country. And we are putting clinics in the local markets. Generally, each hospital will be able to sustain 6 to 12 clinics, depending upon distance. The women will go to the clinics first. They will be treated there. When testing is needed, they can go to the hospital. For birthing, they can go to the hospital. If situations arise where they need a higher level of care than the nurses and the midwives can provide them, they can get there. We dealt with issues of transportation, and not just transportation for emergency, but transportation in the normal course of business. Many of these women will have already given birth and will have children of their own. You want to make certain that the children that are coming with mom are treated well and there are facilities for them. But the clinics themselves are remarkably modern with great equipment, and they are based upon a simple model of the unit clinics have to be economically sustainable. One of the things that we did, and it comes purely out of commercial franchising, as most of these ideas now do, is we took a page out of the fitness industry, and the woman will pay a membership fee, and that will be her fee. So she'll have not one fee up front, but she'll have a package price, which will cover everything from prenatal to birth and issues. Also, the system has been developed in a way, and this was something which I pushed for, where it just didn't deal with women during pregnancy. I wanted to deal with young girls as they entered menstruations, and I wanted to deal with older women as the problem. So I defined it as, if you have a womb, this system is going to take care of it. And it just wasn't limited to the small piece, very important piece of birthing. This was dealing with the woman as a person and her special needs, different than a general practitioner could give her.
And Michael, is this taking place outside of Accra and other parts of Ghana where access to this kind of maternal health care might not be as good?
Well, it's starting in Ghana because the thing you have to do, and Peter can also talk to this, is one of the problems that we see in the NGO community, which we sometimes see in commercial franchising, is people have an idea and they launch it, and they don't test it, and they don't refine it, and they don't I mean, even with great minds and a lot of analytics, life changes in the real world. Everything can happen as you expect, and the results are different, and those differences can be material. So we're going to run this in Accra for a while, probably a couple of years, and develop the system more robustly in Accra. And once we get through band-aiding some issues and then retooling some issues, we'll be comfortable enough not only to take it outside in other markets in Ghana, but to start to export it into different markets around the world. And that's the ultimate goal, growing this system. But rather than grow something that is not ready for prime time, we're used to in a commercial world of testing things, making sure they're right, fine-tuning the marketing, fine-tuning the services, making sure labor's right, making sure our price points are right. And, you know, as most of the supported NGOs that deal with our task force, that's the path we're taking them down. It's a purely commercial path for sustainability.
Great. Well, it's a really an exciting model and a great partnership with Farm Access and others, the government of Netherlands and others. So I really applaud you for being a part of it, and we'll be interested in learning more about it as it starts to establish itself and then looks at the possibility of being replicated elsewhere. You had mentioned the task force, and I think that's an important kind of theme that goes through this webinar, is that we at UNH do our work in cooperation with both on campus, the Rosenberg International Franchise Center, and also with the Social Sector Task Force, which is part of the International Franchise Association. And one of the key elements of our relationship is a mentoring program that we have been able to be a part of for the last couple of years, where very high level senior franchise executives are able to be available to up and coming social franchisors on a long-term basis, to a mentoring relationship that lasts for about 8 months. That's our accelerator, and that's an important part of what we do. And I'm happy to bring in Peter Holt. Peter has been serving as a mentor this year for a brilliant company in India called Pollinate Energy. Last year, he served as a mentor for GBOO, and from the standpoint of our mentees, our proteges who are receiving from Peter, it has been a really positive. And as we would like to accelerate, we want to accelerate companies. Really have been a process of moving these companies forward. So, Peter, you've been serving as a mentor for the accelerator program for a few years now. Can you talk a little bit about your role as a mentor and what have been your own learning and important takeaways from the experience? In particular, what are some of the unique challenges and opportunities of using franchising for social impact?
Sure. I mean, those are all great questions there, Bill, and trying to unpack them. I mean, the first part of that is describe my role as a mentor, and that I would say I've been extraordinarily fortunate in my life in that I've really had mentors almost my entire life, and that have helped me accelerate my own experience by shared wisdom. And so what it is it's this incredibly unique and special relationship where somebody is taking a vested interest in you and saying, I want to share my experience in a way that can help accelerate you so you don't have to make those same mistakes, or you can learn from some of the things that I've done without having to go through it yourselves. And so that it really is this great relationship, but it is absolutely creates and requires both sides to be fully engaged. I mean, you cannot mentor somebody who does not want to be mentored, and you certainly cannot force somebody to mentor you if they don't want to play that role. And so it's a very fundamental role that both parties have to be truly interested in wanting to be a part of. The second thing I would say about the role of the mentor is that more than anything else, it's an exercise in effective listening. That if you believe that mentoring is just simply vomiting out everything that you know so that you can help this organization, it's pretty ineffective. Because what we're really trying to understand in that mentoring role, and again, understand mentoring is basically, in this case, let's say with the University of Hampshire, it is a 1-hour call once a month for 6 months in this case. Now, like with GBOO, because we started that last year, it turns out that we are continuing those ongoing conversations, so it hasn't ended, but it's still become the 1 hour call once a month between Uganda and Scottsdale, Arizona. And so to make it most effective, what you truly have to do is listen to what the challenges are that your mentee is bringing to you, talking about, and then carefully pulling back your own experience and say, okay, what in those elements of what I know could be of use or relevance to the discussion of hand. And that is a fundamental exercise of listening.
Yeah, you have to be good.
Listening isn't easy.
Yeah.
And I think that we all have so many stories to tell. And maybe I have all this great wisdom that I want to share, but you know what? It doesn't matter if it's not actually if I'm not understanding what are the true needs of the mentee that I'm talking to. So that's certainly one of my, from my perspective, one of the crucial elements of being an effective mentor is your capacity to listen.
Sure.
That, some of the takeaways that I would say over the years in this engagement of mentoring is it's kind of funny. I think that franchising, in a way, is an element of mentoring. And what do I mean by that? I have a lot of different ways that I talk about franchising. And that one of the ways that I talk about franchising is the business of accelerated learning. So what are we saying here? What we're doing is we're taking experience and we're learning how to operate our model, because any business or any entity that does not have an operating model to be able to convey to another entity or a franchisee doesn't have a business to franchise. So we have this operating model that has to be conveyed in a short period of time to our franchisee. And so where did that operating model come from? It came from experiences that we worked with and worked well, much like what Michael was talking about, testing, organizing, restructuring, making sure that this is most effective. Well, that comes from experience in the field. That comes from the research behind it, implementing it, learning from that, and then taking that experience and putting it in a package that I can push out across the whole network. So I can go out into my network, look at a best practice and say, wow, this is great. Not only will it influence this one clinic, I can take that, roll it across all 400 clinics, and the whole system improves. Well, that's what mentoring is in a way, is that you are sharing that experience to accelerate the growth of the mentee that you're talking about. That I'd also talk about, my experience with mentoring, or what the experience has given me, is that I would tell you that it's given me more than I've ever given. That unlike Michael, who stumbled into, Michael started in a very strict commercial relationship and then stumbled into the world of social franchising. I almost came in the opposite direction. That I have an undergraduate degree in political science. My master's is from the University of London in Latin American history. My goal was to do policy analysis of U.S. Latin American relations. I wanted to help develop in the third world, and specifically Latin America. And through a funny coincidence, I ended up at the International Franchise Association and selling memberships. And what I learned was that this amazing model of franchising was so exquisitely adaptable to developing countries. Because what it was doing was it was giving this complete transfer of business technology. It was limiting the amount of resources that would be pushed back up to the parent company in these master franchise relationships, for example. That it was a complete transfer of business practices in these countries that truly needed it. It's creating a vehicle for local investment where you had so much capital flight in some of these developing countries, because capital is going to go where it can get its best return. And if you can create opportunities in that local sector, and all of a sudden that you're literally creating jobs, creating information, creating business skills in the places that most need it. So I had always had this passion for seeing franchising as a model of growth in developing countries. Ultimately, I ended up down this path of working for commercial franchising. And what's been so fun is coming into the social sector franchising task force that Michael founded, was truly creating this vehicle where you can bring all these parties together. And much of the work that you've been doing at the University of New Hampshire is doing that same thing, because you have all these different entities that have been separate. You have commercial, you have academic, you have the NGO community, and then you have the donors. And where are we coming together? I think the work that we're doing with the University of Hampshire, the task force, the IFA, the is really, really an exciting time to see this really come together and be of value. The kind of the last part of your question was looking at what are the unique challenges and opportunities of implementing a franchise model in a social sector perspective. And I would actually echo much of what Michael said in his remarks, is that there's so much similarity in terms of how we can effectively create a sustainable business model or an entity, whether it's an NGO, by following the structure of franchising. So as I said, I've been doing a lot of work with GBOO. They truly are a commercial franchise with a social mission, and that they are, and as we go through the last 2 years, so many of the conversations we have are about the exact same development issues I have when I'm building a franchise system in the United States. It's establishing roles and responsibilities between the franchisor and the franchisee, understanding this incredibly unique relationship. There is no other business form of development that is like franchising. It is unique. That it's not, and there's so many ways to grow a business or for an entity to expand. We can do licensing agreements, we can do agency agreements, distributorships, corporate growth, partnerships, joint ventures. Franchising is just one more element to utilize. Mm-hmm. What's so interesting to me is as you're looking at these different relationships that and how that you take the franchise experience, is that much of what GBOO is doing is the same challenges I had when I was doing startup franchising in the United States. Now, one of the things I talk a lot about franchising is there's nothing intuitive about it in terms of its understanding. You don't charge a franchise fee to a franchisee and all of a sudden that franchisee knows how to be a franchisee. You don't create in this country a franchise disclosure document and then say, oh, I now know how to be a franchisor. Both parties really have to spend the time to truly understand what is my role as a franchisor and make sure that I'm holding myself and my franchisees are holding me to accomplish that role. Well, it's the same thing with a franchisee, is you have to explain to them what their role is as a franchisee. This is what you need to be doing. This is what I need to be doing. We're going to hold each other accountable in that process. And so as we go through this, what I'm struck by is how similar the issues are, regardless of whether you have a social mission or not, if you're effectively building that. One of the things that's so interesting to me in this field of NGOs as we're exploring and experimenting with this kind of franchise model, and I've talked a lot about this, is that we have to be very careful here that we're not confusing elements of what are incorporated into a franchise system and then thinking it is actually a franchise system. That just because that you have a training program does not make you a franchise system. Just because you have operational standards does not make you a franchise system. Just because you have a brand does not make you a franchise system. Are those elements to franchising? Of course. To me, the core of really unleashing this unique relationship between the franchisor and the franchisee has to have what I would call vested interest. All that means is that franchisee, they're not my employee. They are somebody who's putting something that's really important to them, and typically in our world, that's capital. I'm putting the business up to buy my franchise and to build it and to run it. That gives me a vested interest in the outcome of that entity or that business in our case. That is different. And that's the power that we're trying to tap in that allows these programs to become self-sustaining.
Thank you, Peter. So let's talk a little bit about GBOO. You have been involved in mentoring GBOO for informally within our program, but you're actually involved with them previous to the UNH program, and you're continuing to be involved with GBOO. So you really have some good insight information about what is working for them. So if you kind of think back over your relationship with GBOO, and it's been a very dynamic few years for them, can you identify a specific turning point in their growth? And what do you see as the strengths to this approach to providing clean water and livelihood opportunities in what is a challenging environment? They're in Kenya, they're in Uganda, they're in Rwanda, they've moved to Zimbabwe, they're looking at other expansion. What is the secret sauce that's possible for GBOO to have this success? from your
Another great question. And I would say that if you really want to pull that back to what was the point that really fundamentally made a difference, it is when the founder, that there's, the father is Randy Galen and or Randy Welsh is the father. It's Galen Welsh. He was really the founder of the company. He was a young man who was in the Peace Corps in Africa, came back, really wanted to make a difference, and returned, I think it's actually in Morocco, but returned to Uganda to really create this idea of delivering clean water in the communities, in this case, originally in Uganda. And that through the creation of the Next Gen program, which is sponsored through the IFA, and they were trying to identify young entrepreneurs who are out there and using a franchise model that are really trying to make a difference, and to bring them into the International Franchise Association, specifically to the national conference or international conference, where you're bringing the largest gathering of franchisors together. And that's actually where I first met Randy. And I think that what that did for Randy is absolutely gave him a point of reference and an understanding of this incredibly amazing world of franchising that he never could have had simply trying to build and manage that system in Uganda. That started creating all these relationships within that, and he was one of the winners that year, so that created this connection. And then he suddenly realized how profoundly powerful that the IFA could be for him to continue to leverage the experience, the people in that community, to accelerate the growth of his own business. So I think that if we're saying, okay, what was one of the key elements that fundamentally put them on a path to where they are today? Absolutely, it was winning the Next Gen prize, which funded him to go into the conference, I think it was in Las Vegas, that he never would have done otherwise. That now watching him, and that was when I first met him. And then it continued the conversation and started talking about different ways to apply the experience of what you're doing there and how it applies to franchising. It really did create this friendship. And now we're back to this whole idea of mentoring, is that through that relationship, we were able to start having these conversations, because he'd ask me different questions about, what did you do when this happened? Or how do I handle my franchisees? They seem to be wanting to form this National Franchise Advisory Board. But, I don't know, is that a good thing? Is that going to take into the company? And so you start answering these questions, and it becomes more and more interesting for them, that then ultimately led into what we did at the University of Washington, where they were one of the case studies and created this much more formal conversation. And I would say that, again, that experience at the University of New Hampshire for GBOO was instrumental in taking them to the next level, because it set the framework to start truly understanding how do I build and manage a franchise system, relying on experiences way beyond what is traditionally available in the Uganda market. And I think if you talk to the leader there, Mark, who's running it, he would tell you again is that was kind of the turning point for him. And if you go back today, he's probably one of the most knowledgeable people in Uganda on how to build and manage a franchise system, because there's just very few people who are doing what he's doing. And so then that, again, to me, was one of those benchmark moments where it really gave them a huge opportunity to step up to a different level.
Yeah, it's been exciting to see. And Mark was, as a member of our cohort last year, was it was pretty exciting to listen to him as he kind of struggled with some of the issues and found solutions with your support. So it really has been dynamic. I want to let folks know that we do have a descriptive case study, and we'll soon be launching a full case study about GBOO as part of what we're doing here at UNH. Is in addition to providing support for social franchisors through this mentoring program, we're also going to capture that and make the learning available to practitioners and others out there, so that they have the opportunity to learn from pioneering experience of these social franchisers who are doing great work like GBOO and what's happening in Ghana with Women 360 and others. So now I want to open it up to both of you to talk about, this is a field that's probably about 10 years old. We've seen examples of social franchising that have been used in reproductive and maternal health for probably a longer period. In the past few years, have we really seen entrepreneurs who are doing their best to take the model and try it out in many different sectors? So we're really starting to become a field as part of, again, what we're trying to do at UNH is to do some field building. But what, from your perspectives as commercial franchisors that have been able to grow, nationwide franchise systems to work with, dozens and dozens of commercial professionals and with social entrepreneurs, what do you see as the growth potential for social franchising, and what needs to happen in the next few years to realize this growth? And both of you can weigh in on this. It'd be great to hear from both of you.
Michael, do you want to start, or
Bella, I'm losing about half of what you're saying, unfortunately, because of the hotel's internet.
Okay.
If I hear you about what the future is, if that was where the question is, let me address it from the point of one of the areas we haven't talked about yet, and that's one of the impediments to commercializing, and that's not a bad word really, although it once was. I didn't realize I was being insulted at a conference one time, and they kept calling me a commercial franchisor. And somebody came over and said, "You realize that they're insulting you?" And I had no idea that that was a bad term. One of the issues that needs to change, and it's not yet changing in to the extent it needs to, is in the donor community. There's a difference in how we look at business on the commercial side and how NGOs look at business. We measure business at the consumer level. Will the consumer come back and use their resources to buy our products? That creates a real incentive for the franchisee to do good. They will have selected a system that gives them the basic tools to make their sandwich or rent out a hotel room or cut hair or whatever they're doing in the commercial world. They then will take that system and they'll not change it, but they'll deliver it in a way that is beneficial. And we measure things through unit economics, and we measure things through consumer satisfaction and head counts and customers and all of those things. You can only drive so many bodies into a location through advertising until you run out of them, unless the franchisee or the operator is doing well. In the NGO world, a lot of the time the products and services were given away at a cost that required and still does require support from donor agencies, foundations, government agencies. And often they come in with requirements which are not in sync with the franchisor's mission. They'll come in with changes to policies and missions, and they'll come in with requirements of human resources. They'll come in with measurements that they want to see. Rather than looking at it the way that Peter and I in commercial franchising looks at it, is all they're asking for is us to deliver a product or service. And franchising does best when it can integrate that product or service into its system rather than be disciplined by the donor system. So donors need to understand at a different level what franchising is all about. Peter's right. You see a lot of companies that, and I see them at conferences, and they'll stand up and they'll be introduced as a social franchisor, and they're not. They have a training program, may have a manual, they may have a brand, but they don't have the essence of what a franchise system is commercially, nor do they know how to measure it or recognize its performance. And the sustainability of it only goes to the next grant that it gets. What distinguishes where we are in commercial franchising is we understand there's a need for financing that may not be the same as we're used to in the commercial franchising world. But let's look at the healthcare industry, both in the clinics we have in Kenya and Rwanda, which is now about 167, 170, in the birthing centers in Ghana, in other markets which my firm mentors in frequently. And where the grants come in at the top of the organization and they grow the headquarters company, those companies are less than sustainable because their cost of labor is too high. They're paying executives salaries which they should not be paying. They're paying Washington, D.C. salaries for an entity in Rwanda, which doesn't make sense. Where Peter and I look at it is, where does the money, if the money enters at the consumer level, that's the better place to be. And if you think about the healthcare system in the United States, that's exactly what's happening. You have a government entity, Medicare, Medicaid, Social Security, and all of that, which provides the resources at the consumer level. Now, it's not the most efficient way to do it, but it creates the choice of what doctor I go to. In the NGO world, they all, you know, part of the difference, the way I define the difference between commercial franchising and social franchising is the difference between, as a commercial franchisor, I provide things that people want. As a social franchisor, I provide things that people need. That's a whole different way of looking at things.
Yeah.
And the need often is I may be the sole provider, where if I don't like Subway, I can go to Jimmy John's or I can go someplace else. I may be the only one within 5 clicks to do a decent job. So the future has to be a educational process, which makes it very exciting when you see your university, University of the Ohio State University, Harvard University, with their couple of days of conferences every year, and Kash Rangan's programs at the bottom of the pyramid. That's where the change will come, at the donor level. And we can't forget that we have that frailty in that process.
Sure. Thank you, Michael. What are your thoughts, Peter?
Well, I think I certainly would mirror a lot of what Michael said. I think that we also have to understand, number one, is that social franchising is not the be-all to end-all to everything. That it is just one element of a way in which that we can, in this case, help deliver the needs in developing nations, and do it in what we're really trying to do is in a sustainable manner, so that it isn't simply relying on the donations or from a donor to make the program sustainable. Now, one of the differences is that you may need that as a catalyst to get some of these programs off. Not all of them, but some of them. That I would also say it's really important it's really been exciting to see, as we've talked about, the innovation that has been taking place in this field over the last 10 years. I can remember when the first task force, International Franchise Task Force that I went to, and it was talked social franchising. Well, there were a handful of people in the room, and half of them thought they were going to a social media program, not social franchising.
Yeah.
And I think that we've come a long way from there. And what I'm really excited about the work that you're doing, that the IFA is doing, the task force, and more as we're bringing all these entities together to really explore what is the most effective way to utilize what ultimately is one of the most powerful ways that you can deliver sustainable services and products across the world. And that truly, that is the opportunity. It won't be for everybody. It doesn't necessarily get you to the bottom of the pyramid, because that there is got to be that sustainability of it. And so that if we have to create, design a program that covers from the very beginning, the very bottom of that pyramid, this system or this structure may not be appropriate. It may not be able to reach that deep and still be sustainable. There is a place for donors. There is a place for the traditional development that the NGOs are so focused on. And so I think that we have to recognize that this is just one more tool that allows us to have, I think, an ultimately enormous impact on a growing and important field.
Sure. And you guys
Peter,
have,
let me jump in for a second. I think you would admit, though, that even if it, even in the world of commercial, that where franchising is a piece of the distribution channel, it's not the be-all and end-all to every solution. There are perfectly good reasons that Starbucks is not a franchise, and they do extremely well doing that. But even in the world of the pure NGO, the classic NGO, the way that they go to market, changing the mindset of how they view their contribution so that they're viewing more on not rooftops being established, but on sustainability. So they look at funding in a long-term nature rather than a short-term nature, that they look at the organization as, am I providing the support necessary, or is the NGO providing the support necessary to make that business as good as it can be, even if it has to be sustained by donor? And we'll often look at grant proposals that have been approved or in the process of looking at it, and there's not a line there for training, there's not a line there for field support, but there is a line there for several $100,000 for a CEO salary, which is an issue for me, because not that they should not make a good living, but before they do, you need training and field support and selection of the candidates and market analysis and all those other things, whether they're a franchise or not. And that's not to be critical of that market, but that market has come up short because they don't focus on the business realities, even if it's a business that needs to function on grant dollars.
Well, and Michael, what I would say to that, and we have to be very, very thoughtful about when we talk about the NGO community, it's like talking about the franchise community, because you can make those exact same statements about those commercial franchisors.
Oh, sure.
There's a lot of commercial franchisors out there that aren't doing it the way that you and I want it to be done. And so when we say franchising, or when we say franchisors, or when we say NGO community, my experience with the NGO community is like franchising.
I don't mean to condemn the whole community. There are fine NGOs, don't get me wrong.
Yeah.
The problem I look at it is from where the donor market pops in, and they are providing the resources in a way that they did 10 years ago, but the market really has changed with double bottom line investors and people now looking at this model in a whole different way.
Yeah, and it's evolving. I think if you look at just the whole NGO community and as a whole, which is, again, it's a very, very, we have to be incredibly thoughtful trying to treat that as one entity, is that what I would tell you watching over the last 10, 15 years is there is an evolution in the way that they're approaching it, and some of them are leading the ways, others are more traditional in their perspective, but there's some really exciting things going on.
So we're talking about really the kind of key foundational issues of and contrast between commercial and social franchise. And we have a question from our colleague Hashmi Eloish here from UNH, and he is asking, do you see a point when social franchise systems that are currently dependent on donor funding become financially independent? And if so, what needs to happen to this occur?
Let me jump in there first. I think that all social franchise systems, if they're true franchise systems, have to have a goal of sustainability at some point.
Absolutely.
And you look at companies like GBOO, which I think have moved from a social franchise, and stop me if I'm wrong, Peter, they moved from a social franchise to almost now a commercial franchise with a social mission.
No, I will stop you, because I think that they, from the beginning, truly tried to build that on the basis of a franchise model.
Right.
That they structured themselves from the beginning to do that, so that, no, I mean, they did not start out, okay, I'm a social franchise, I'm not worried about
they started out to be a commercial then.
Absolutely. Now, a commercial entity with a social mission. So the social mission started at the beginning of that organization at the same time that I want to create this on a basis of a commercial platform.
Okay. See, the system that I got involved in first, CFW, started out as a social franchise. We're now into a reality that we are seeing the government's finally coming through with medical insurance payments, and it now changes the nature or the opportunity of the business to broaden it, so that we're changing the model now into a commercial franchise with a social mission more than before. We were a social franchise with, needing resources differently. The model in Ghana is purely with a goal of being a commercial entity. When we first started looking at it, everyone wanted to look at the system holistically. And as Peter and I would do, as a natural commercial people, is we looked at it from a unit economics. Would there be enough traffic in a particular market to sustain that franchisee? What was the population in the market? What was the transportation available in the market? All of the things that we would look at from a commercial side, we looked at there. So in that model, it was truly a commercial franchise goal, and it will function as a non-for-profit for a while, and then it will move in. But I think that the issue of there is a room now, and you see it with Kentucky Fried Chicken. Kentucky Fried Chicken is going into Africa with a vengeance because there's this huge opening because people like a very good product, and they have a really good product. And they are going in as commercial franchisors in a market filling needs. So what you're going to see, and I think that social franchising has a lot to do with it, is you're going to start to see commercial franchising coming into markets where they didn't look at it before. I mean, picture, there are places which people avoid because they have stereotypes of what Africa is like. You go to downtown Nairobi, it's a hot market. You go into Nigeria, there are some hot markets. But people have viewed Africa from the point of there's South Africa, and then there's this wasteland. So commercial franchising is now coming in and selling products. And they're selling products, not just water and healthcare and education. They're selling chicken. And they're selling hotel rooms. And they're selling printing services. And they're starting to fill in this gap as the economy improves in these markets, because the good news about a lot of the third world, or the bottom of the pyramid, is that this whole idea of what is the bottom of the pyramid, it used to be people living on $2 a day. And now all of a sudden there's a middle class where you can measure them in thousands of dollars a year. So the market is changing, and commercial and social franchising will be in that market. And eventually social franchising won't be as much needed because the economies and the livelihood will change. But we are dealing in a radically different market than we were 10 years ago as far as the economics of the market, the health of the market, the improvement of democracy in many of these markets, which I think is also part of this export from the United States and Europe, of as you export an economy into a market through opportunity, you export a democracy that goes along with it. And I think that that's a side benefit, which we don't often discuss, that we are having a broader impact than just the delivery of products and services.
Sure. And I worked in sub-Saharan Africa for about 14 years, and it was very hard to find a franchise of any kind when I first started working there. And now you're definitely seeing come in more and more. But, with all due respect to Kentucky Fried Chicken, which I like, it's not a double bottom line product. It's not a product that's going to cause Ghanaians or others to have a healthy diet necessarily. I think that bottom line, that kind of social impact piece is really the key.
It does create 30 to 50 jobs at that location, which then allows people to go out and have a good life.
Yeah, no doubt. I think I guess the question is, to Hash's question is from the unit economics of being able to really get beyond the big urban areas where it makes sense to start your franchising there because that's where the people are, but to really start to get out to the peri-urban areas or even rural areas and be able to maintain the double bottom line, be able to be financially sustainable, and also to be making an important social impact. I think that's the real challenge. And to your earlier point about donors and their kind of orientation is that they have to have a different time horizon, and we have to look at multiple ways of funding these social franchise businesses, to not assume we can go in with a typical commercial franchise financing package that we use in the United States, but being able to use kind of a distributed system where maybe there's some government money, maybe there's some NGO money, maybe there's money coming in from customers. I think, those are the challenges that
Bill, most of my experience is in the peri-urban and the urban areas. That's where I began for the first 8 or 10 years of my experience with the NGO community. The issues there become different only in the extent of the last mile becomes a challenge. The idea of a sustainable supply chain in the middle of the rainy season in Africa, creates issues which we could not fathom, because it's not a matter of the road being wet, it's a matter of the road doesn't exist.
Exactly, yes.
I've gone over to the Middle East and have looked at drone systems 5 years before Amazon was dealing with it. They were dealing with it in the Middle East to see if we can get 2.5 kilos of drugs flown into a market during the rainy season. We have flown into areas, we rent planes and we fly into areas because there's no other way to get there. So but the difference is that terminating a franchisee in urban Kenya or Rwanda, in the most rural of places, because they've done a serious violation of a standard like buying, black market drugs, when we know that half of the drugs that we see are bogus, and we deal in supply chain and authentic drugs. Those standards don't change. So
Right.
If you're going to have a model where the woman comes into a clinic and she is sheltered from the rain because you demand to have a waiting area just like you would have in Beverly Hills, maybe not as pretty, but as functional, those standards don't change. The medical care doesn't change. The fact that all the medical records go into the cloud doesn't change. The issue of making certain that the drugs are authentic and that the franchisees are trained and supported, they don't change. What changes is the unit economics, and the units that are in the cities, just like we do in the United States or in Europe, some of that money goes to support locations that are not as robust for the franchise system.
Sure, kind of a cross subsidies.
I just want to step in one quick, because I think you hit the nail on the head if you kind of pull this back and talk about the absolutely fundamental issue to go back to Hash's question is exactly right. It's financing. And that why franchising works in the United States as effectively as it does is there's a robust financing system, because if you look at what is franchising as a business model, it's leveraging capital. And so what I'm doing as a franchisor is I'm finding a franchisee who has capital and is willing to invest in my business model, and by leveraging that, I can accelerate my growth. And so when we go back into the how do I take a social sector franchise and make it sustainable, there's two elements that have to happen. One, and much of what Michael was talking about was, okay, business model. So the system itself has to be able to, at some point, that's a viable business for the entity I'm in this case, a franchisee. But the other side of that is, how do we address this issue of financing, which allows the acceleration of that growth? Because if it's not there, you are going to be relying on donors, on government agencies, on something to fill that gap that's so clearly available in developed countries that is missing in developing countries that would allow us to go sustainable.
Great. We are down to our last minute of the webinar. I want to thank you. We could keep this going for, I'm sure, another half an hour, 45 minutes. You guys are very knowledgeable about this, and these are things that are kind of a very quickly evolving field. This is what's exciting about social sector franchising. It's very dynamic. If you're interested in being a part of the social sector franchise initiative, you can come to our social sector franchise innovations roundtable, which we will be holding on October 10th and 11th here at UNH in Durham. So we will be sending you information. If you're part of this webinar, we'll definitely let you know about that. We really appreciate Michael and Peter taking the time. You guys have been a huge help to our program here at UNH, and your knowledge and what you've been able to do for GBOO, for Pollinate, for Health Stores, for Women 360, and all the other organizations you work with are really game-changing and life-changing for the customers, for the clients, for the people in those communities. So We thank you for your commitment to this field, and we thank all of you for tuning in to being a part of this webinar. We hope to have a third webinar probably in August, where we're going to capture some of the learning from our last couple of cohorts in this social sector franchise accelerator we've been doing, and we hope you'll be able to join us. So watch out for that. So thanks again to Peter and to Michael, and I'd like to wish everybody a good morning, good afternoon, good evening, wherever you are, and tune in next time. Thank you very much.
Thank you very much.
Thank you.
Take care.